I'm Dr. David Hubbard. I'm an associate clinical professor of neurology at the University of California, San Diego, and I'm medical director of the MyoPoint muscle injury clinics. You are watching this videotape because you are in the emergency room and you have just been diagnosed with a cervical strain injury. We have discovered that that doesn't mean very much to patients, and that the more they can understand about exactly what a cervical strain injury is, what are the other possibilities, and what they need to do about it, the better they'll do.
Cervical strain or neck sprain is an injury that occurs when the neck is forcefully whipped backwards or sideways, causing excess stretching of the muscles of the neck. In the first 48 hours after your neck muscles have been forcibly whipped back and forth or sideways, there is swelling and inflammation in the muscles. This response can cause pain, soreness, stiffness, and tenderness to the injured muscle. The pain and stiffness may get worse for a few days rather than better, which can be fairly severe. This is to be expected and does not mean that something else is wrong. After all, muscles are the largest organ system in our bodies. You may also experience headache or even periods of mild tingling in both arms. Nevertheless, you should contact your physician or emergency department if you develop fever, drowsiness, difficulty breathing or swallowing, weakness of your arms or legs, significant numbness, especially only in one arm or leg, or any new symptoms that you are unsure about. Now let's spend some more time finding out exactly what's happening to your injured muscles. This is a picture of a muscle spindle. Muscle spindles are tiny Rice Krispie-sized things found within the muscle and are responsible for detecting pain and pressure, as well as assisting the muscle in movement. During an injury, the muscle spindle is overstretched, creating muscle spasms and pain. Now that we have discussed what a cervical strain is, what exactly is wrong, and what can be expected, let's talk about what you can do. During the first 48 hours, apply ice packs to your neck for 10 to 20 minutes each hour. Put the ice in a plastic bag and wrap it in a clean towel, 1 layer thick. After 48 hours, switch to a warm pack or towel soaked in hot water and wrung out, or sit in a hot tub or take a shower twice a day for 10 to 20 minutes. You can do this as long as you are still having pain, and it should give temporary relief. During this time, it is important to maintain muscle activity gradually. Guarding is actually a false alarm during this phase, which is important to overcome so that the muscles do not become stiff as a result of immobilization, which leads to tension. If you are prescribed a soft collar, remember that it does not support your head or neck. Its purpose is to remind you not to make sudden jerky movements of your head. You may also have been prescribed pain or muscle relaxant medication, which you can take as directed, but do not take so much that it makes you drowsy. Fortunately, almost all patients, after getting worse for a few days, gradually begin to feel better and recover. Unfortunately, not all patients recover this quickly. After the initial swelling and inflammation subsides, the muscle spindles stay in spasm by adrenaline. The adrenaline is produced from stress and tension. Essentially, this means that certain physical and emotional stressful conditions tend to produce tension, which in turn leads to muscle pain. If you are one of these patients, you may need additional treatments such as physical therapy and biofeedback. The reason the biofeedback component is so important is that your injured muscle spindles are kept in spasm by adrenaline, which in turn is produced under conditions of stress and tension. Biofeedback assists in the awareness of tension. Here's an example of biofeedback, which displays the tension levels of this person.
Would you describe muscle tension?
It feels like a tightening between my shoulder blades.
It is important to recognize that muscle pain is aggravated by muscle tension, which also means physical and emotional tension. Physical tension occurs upon immobilization or exertion of the neck muscles. Therefore, overusing or underusing your neck muscles may create pain. Emotional tension occurs with anger, irritation, and frustration. Examples that would create such emotions would be financial difficulties encountered upon getting your car repaired, your spouse leaving his socks on the floor, re-entering the environment within which your injury occurred, or a boss giving you a new assignment just before 5 p.m. These examples can cause a tightening between your shoulder blades, much like the hackles of a dog when the postman comes into the yard, a trespass reflex. This tightening increases the spasm and pain in your neck.
Phones ringing, pressure with things that have to be done, entering orders, worrying about the market, all of which tend to, in creating this increase in tension, which leads to pain.
Our bodies are important barometers. Our bodies have lots of built-in signal systems that tell us when we need to take action. And so we teach patients to be able to discover what are the triggers in their everyday activities that fuel the muscle tension. And then the last and perhaps the most critical step is teaching patients to be able to resolve the various triggers that they discover are triggering their tension.
Hello, my name is Dr. Banks. The real secret to success is to learn how to recognize the physical sensation in your body when the spindles start to tighten, not when the pain has already started to increase, which happens several hours later. This spindle sensation, or tension, is a subtle tightening sensation between the shoulder blades, which can come and go over even a few minutes, but if ignored, will surely lead to increased pain later. In addition to recognizing physical and emotional triggers of tension, while attempting to resolve the cause, other strategies can be temporarily helpful. You can try taking a short break during activities, or perform neck stretch exercises with gentle movements.
When you have a spasm, the pain may stay in the neck area or be referred to other areas. Stretches are helpful for this type of pain. When you perform a stretch, you want to make sure that you allow yourself plenty of time and remember to continue to breathe. Stretches can be done anywhere. If you feel pain when doing the stretch, don't stop abruptly. Slowly ease from the stretch, and when the discomfort subsides, continue the stretch as long as it feels good to you. You may stand or sit. Results are most beneficial when performed 2 to 3 times per day. Now let's take a look at 2 helpful stretches. For the first one, sit or stand with your head looking forward. Then lean your head toward the shoulder of the unaffected side. Slowly look downward, sinking your chin to your chest. You will feel a stretch in your upper trapezius. When finished with the stretch, return your head to the forward position and lift your chin before lifting your ear away from your shoulder. For the second stretch, sit in a chair facing a table and fold a pillow lengthwise and place it on the table and against your chest. Slightly lean forward at the waist and hug the pillow with both arms. Rest your chin over the top of the pillow and tuck your chin toward your chest. When finished, use the hand from the unaffected side to lift your head into an upright position.
Also helpful are relaxation techniques. One such technique is called breathing relaxation. Breathing relaxation is a simple technique that can be helpful in reducing muscle tension. It is most effective when performed in a quiet setting, free from distractions. All you need to do is find a comfortable place and you are ready to begin. Allow yourself to breathe in through your nose while taking in a deep breath down into your abdomen. Then exhale through your nose, allowing any tension or worries to leave with that breath. This should be continued for a period of 5 minutes, 2 times a day. Many people use the muscles in their chest to breathe rather than the diaphragm. A method that is helpful is to place one hand over your chest and one hand over your abdomen. While you inhale and exhale, only your hand over your abdomen or your diaphragm muscle should be moving. It is important to use your diaphragm muscle to breathe because this allows an even distribution of air throughout the lungs, providing a decrease in muscle tension and a relaxed state of mind. This exercise takes some practice before getting used to, but its capability to activate relaxation in the body is quite effective.
Now let's review. If your muscle discomfort continues, you will discover that the trick is to notice the onset of the spindle sensation or tension, which is brought about through physical and emotional triggers. Once this onset of tension is recognized, you will find that all sorts of strategies may stop it, like taking a short break, gentle stretching, breathing relaxation, and most importantly, actually trying to resolve the situation that is causing the tension directly by elimination or modification through problem solving. As your neck pain has been diagnosed as muscular in nature, it is important for you to follow up with health professionals trained in dealing with muscle pain disorders. We hope that this video has been helpful and wish you health and happiness.